right, guys, welcome back to another episode of In the Nick of Time. We are here at Health 2025. We are with the COO of Jorie AI, Chris Mashburn. Is that correct, Chris?
Yes, sir, it is. Thanks, Dr. Zain.
Tell me a little about what the heck Jorie AI is.
Yeah, we've got a lot of buzz out right now. Yes. So Jorie AI is a platform that does all of the mechanisms and processes of AI within revenue cycle. So we've been doing revenue cycle for 20 plus years, and we started the automation process about 10 years ago. So what we do, if you think about Jorie, we can do everything that is done within the revenue cycle process, from starting scheduling, eligibility verification, prior authorization, claims management, coding, denial management, payment posting, and short balance reconciliation. And then we're gonna announce some predictive analytics things that we're doing here at the show also.
So predictive analytics for patient care?
Yes. Okay. As it relates to, we've got 4 disease states that we're actually working with right now. And then, but once we get the platform built, think about, because we're functioning within the process of what the patient's doing from start to finish and what the provider's doing, we take that data and we go back and look at medical history, and we can realize exactly what may be kind of at hand outside of what someone's coming to see the physician for.
So that's very interesting. Tell me, a lot of my followers, a lot of listeners want to know, is this agentic AI? Is that kind of it, or are we still a little bit away from that? And then the platform you spoke about, I know the government took a lot of interest in the potential there. Can you talk a little bit about that a little bit more?
Sure. So agentic AI is a piece of it, right? But it's not the holistic part of it. You've got to have a platform. Once again, we're going to release it, the Smart Core engine, which I'll talk to you about here in just a little bit.
Yeah.
But the Smart Core engine is what's going to give all of the bigger companies that are trying to do AI, it's going to give them the ability to actually work within a healthcare system, because agentic AI is one piece, NLP is one piece, LLMs are one piece, ChatGPT is one piece, but you've got to have the Smart Core engine to actually function down at the transaction level. Gotcha. And that's what we're about.
Yeah. How do you help the average patient deal with the complexities that come along with just, let's say, for example, you get diagnosed with cancer. You have to deal with the cancer, but you also have to deal with the appointments, the billing, the cost, the managing your medications. How can you guys help that scenario?
Yeah, no, that's a great question, and I appreciate it. Because you're a doctor, you get it, right? Because a big part of it is the patient journey. We want to make that simpler.
Yeah.
For one thing, we're going to make sure that the payers pay what they should pay and not put a burden on the patients that there shouldn't be, right? So that's first and foremost. But also, as the journey is happening, our technology will actually function with the patient as it moves through the journey. So we will help it schedule. We'll help it get to MRIs if the patient needs to get to an MRI. We will actually operate almost as the patient's concierge.
Wow.
But we'll do it automated and with all the details behind knowing what the patient's medical records are.
That's much needed, absolutely needed healthcare. I mean, it's so fragmented. The idea that you're telling me you're bringing everything together, that is huge potential in my eyes. I recently saw an infographic that's making its way through social media that says there's 3 times the amount of cost for 3 times the healthcare cost goes to administrative costs as opposed to direct patient care. So about, we're about 1.5 to almost $2 trillion of healthcare costs. How does your platform help decrease that in the future and change healthcare in the future?
Sure. So a couple of ways. One thing, we're very sensitive to the provider because the burden is on the provider today. Yeah. And the complexity behind submitting claims and claims being denied and doing appeals, I mean, no one knows it better than you.
Yeah.
But we're trying to take that burden off of the providers, starting even at the time where the patients are seen. We have a scribe technology, so the doctor can interact with the patient, focus on that, not worrying about doing the notes and closing those out, right?
Tell me about it.
So that's one piece. We want to take that burden off of the provider, give them the ability to do what they do, and that's take care of the patient.
Yeah.
The next thing is the providers have to do so much and spend so much money to get claims appropriately paid.
Yeah.
We're taking that burden off of them. We can take all of the revenue cycle burden cost off of a provider and put it into our automation.
Yeah.
And then the next thing is just being able to submit the claims that need to be submitted, that we know the payer will pay.
Yeah.
And that takes some of the burden off too, because one of the things is the claims process goes back and forth, denial,
Yes.
appeal, so forth.
Yes.
That adds to the cost on the payer side and the provider. So
Yes.
we shorten that. Our goal is that our automation gets it right out of the gate, so that will reduce the cost.
Not to mention the anxiety that comes along with whether or not you
course.
know you're going to get paid for what you did or didn't do. So that's
Yes.
huge.
Yes.
Final question for you, Chris. Where do you see this going in the future?
So, I might be a little biased, but I think the smart core engine that we're unveiling this week is going to be the future, because what it does is we've been doing this for so long. We know the ins and outs. We developed this technology around making it where a provider, it's easier on a provider, it's easier on a patient, it's easier on the payer. And so with that, we'll allow some of the bigger companies who are trying to get into this market, they can plug right into our smart core engine and they can be a piece of that too. But you can't be at 30,000 foot level and still be able to focus down at the transaction level.
Yes. Well, you guys heard it here first. Health 2025. Artificial intelligence is absolutely going to change the game when it comes to healthcare. Thank you so much, Chris. And Jorie AI Automation, go check them out. Check out their website. They'll be linked in the show notes below. I love you guys. I'll see you on the next one.